Mental health struggles are really magnified right now with change, isolation, job loss front and center during this pandemic. This is something that can trigger mental health challenges. So we've invited Lisa Sullivan with the Texas Suicide Prevention Collaborative to come give us some helpful information. Thanks for being with us, Lisa.
Thanks for having me, Judy. We really appreciate the opportunity to talk about this important topic with you all today.
So I want to talk about the impact of COVID-19 because sadness, worry, stress, all these things are front and center right now. How has it impacted your efforts to help people who might have suicidal thoughts or be at risk for suicide?
Well, that's a really great question. And again, we're in the early stages of this. But what we know from the disaster behavioral health model is that there's kind of a cycle that mental health tends to go through. We are seeing elevated calls to the suicide crisis lines, both across the state and nationally, where people are really reaching out for help. This is one of those triggering events that really tests your coping and resiliency skills. And for populations that may have other risk factors, this just magnifies that even more. And so we want to be sure we can do everything we can in our communities to work to keep them suicide safer, to keep all Texans suicide safer.
So what are ways people can connect? And I know connection is important and find that support they need right now.
So from a connectedness point of view, it's really reaching out. This is especially in our older and elderly populations that have isolation as a risk factor to start with. Anything you can do to reach out to that community in particular is particularly helpful because their natural networks aren't available to them at the moment. So phone calls, letter writing, little gift packages, connecting through social media are often ways that we can reach out and ask someone how they're feeling. From there, it's knowing how to connect to care. So knowing about the National Suicide Prevention Lifeline at 1-800-273-TALK, or the Disaster Distress Helpline, which also is a great resource right now as we're in the middle of this. HHSC has just opened up a brand new hotline as well for telemental health, which we're very excited about. And then, of course, the National Veteran Crisis Line at 1-800-273-8255, press 1 for veterans. So these are all resources to connect someone who you may be concerned about to ensure that they have a caring contact and a qualified person that they can talk to.
And I know that a lot of folks are at home wanting to help. Some people aren't working as many hours as they typically would. They want to volunteer. Are there ways to volunteer to help in this mental health space?
Absolutely. We are getting a number of calls for volunteers. And one of the best ways to do this is to reach out to your local suicide prevention coalition. And they are located on our website under the About Us tab at texassuicideprevention.org. There is a great group of people likely in your community or very close to your community that are working specifically on the challenges that have been identified in your region or city or community. So it's a great way to get involved with people coming from any number of spaces. Our first responders, local social workers, our healthcare folks, our schools, and our EMS teams. So it's a great way to kind of integrate in and to pitch in to work at the local level.
At the beginning, I talked about mental health struggles being magnified right now, and I'm supposing that you all are seeing that in your work on a daily basis.
We are. The Centers for Disease Control has a package called the Technical Package of Programs, policies, and practices. If you look at what COVID is intersects with those 7 elements that are so important to suicide prevention, COVID is checking all of those boxes. So the needs and the challenges that we're likely to face especially over this next 60 to 120 days, are amplified greatly. So we are seeing that impact already.
Lisa Sullivan with the Texas Suicide Prevention Collaborative, thank you so much for offering some great resources to folks who may be themselves facing some real mental health struggles during this difficult time.
Well, thank you for having me, and we're on Twitter at Stop Texas Suicides and Instagram as well. We'll look forward to seeing you all there.
Thank you.
Thank you.